Hey guys, it's Anne. Welcome back to another episode of Nursing Uncharted. Today, I have another amazing AMN travel nurse who was a recipient of a Daisy Award this year. And that's what sparked this first encounter with Camille. And through that conversation, I learned much more about Camille. And I just felt that the audience deserved to hear your story and to learn more about what you do. Because I think what you do I don't even know a lot about it. So I'm hoping you can educate me on that. And what I'm talking about is the International Travel Nurse Program. And I cannot wait for you to share your story. And then, talk about the Daisy Award, what that's like, and just kind of dig deep and dive into what you do and what your experience has been. So to start things off, if you just want to say hello and like just something little about yourself.
My name is Camille. I am an international travel nurse from Jamaica in the Caribbean. I came to the USA about 3 years ago. I've been here since, and it has been a good program for me. I don't regret it. Encourage all my friends to travel to other countries and even the USA to be nurses. Yeah.
Yeah, I love it. And, we talk about it, like, since being involved with AMN, I've traveled with them for it's gonna be 6 years, I can't believe it, but they always talked about international travel nursing, and I didn't know what that was, what that looked like, and what that meant. I always thought it was, US nurses traveling to other places, which
Mhm.
can be part of it, but I didn't know your side of things, and I loved our initial conversation. I loved the insight you brought about what nursing was like in Jamaica compared to here, the pros of it, the cons of it, just everything, and, I'm excited for everyone to hear that and learn more about you because I think you're a wonderful person and a great nurse, and it
Yeah,
really shows why you won and why you were awarded the Daisy Award. So you've been in the United States for 3 years, correct? Is
that's
that what
correct.
okay. How long total have you been a nurse?
I've been a nurse for 6 years, going on seven. So yeah, it's been a very interesting journey for me so far. I don't
Yeah,
regret nursing. I love it. So yeah.
I'm sure it's been a whirlwind, I'm sure. What like, how did you get into this? How did you hear about international travel nursing?
Well, it is publicly advertised on social media and stuff. And even through while going to nursing school, it was an aspiration of mine to broaden my scope overseas after completing my bachelor's in Jamaica. So I actively sought out information and programs that facilitated this transfer.
Yeah.
So yeah.
Yeah, so what is international travel nursing? Like, I mean, it's simple, but, like, the deep down of that, what does that look like? How long can you stay here? Do you have to go back to Jamaica? Like, how does that work?
So it's a program that facilitates the migration of registered nurses from outside of the USA or other countries. Yeah, they allow us to get certified here in the US and then be contracted to a hospital for because the hospitals usually sponsor us for a contracted period of time. So some agencies that do this program, they do 2 years, and other agencies do 3 years as a contracted nurse to that
Right.
hospital. Yeah.
Yeah. Okay, so you're coming up on your 3 years with the same hospital, or have you moved?
Yeah, I'm with the same, but I completed my contract. I decided to stay at this hospital. So yeah.
Oh, I love that. So, that's exciting. So is your goal and what you want to stay here in the United States?
Yes, it is my goal, but I do have the opportunity to travel back and forth to
Yeah.
my original country, Jamaica.
Yeah.
So yeah.
Oh, that's so exciting! It's so exciting! I'm learning more about this as we're talking because I didn't ask these nitty-gritty questions the first time, but I just was so intrigued, even, like, writing up our outline together, I'm just like, "Oh my gosh,
Mhm.
so many questions because I just think this is a great opportunity for you. It's a great opportunity for the hospital that you're at for you to bring something new to the table as well. And I think that that's what makes, hospitals, that's what makes, everything so well rounded is that it's not just one way. We are able to be influenced by so many different people from so many different backgrounds and so many different cultures, and I love that. So and what specialty are you in?
I initially started out doing med surge, but now I'm floating around the hospital. So I float to step down units. I float to the emergency department, mostly where the borders are kept. Yeah, and sometimes transitional units, the post-operative unit, pre-op unit. So it's a good experience.
That's a great experience. I think that being able to work in all those different departments, sometimes I reflect back on, what I do. I'm neonatal ICU. I don't know if I've ever told you
Mhm.
that, but it's so specialized that if I wanted to broaden, my scope, it would take a lot because I'm just so used to one unit. So I think that it's the float pool getting into that, you can figure out you might fall in love with a specific unit and be able to have the experience to go into that unit versus someone who may not. So I
Yeah,
love
that's true.
I love that. Plus, you learn so much more too, which is great. So, are you on the East Coast? Is that correct?
That's correct.
Okay. Yeah. And am I right? In Delaware? Yes. No.
Delaware, yes.
Yeah. What do you think? I mean, you've experienced winters?
Yes, I have. Not my favorite season.
No, I mean, and unfortunately, I've never traveled to Jamaica, so I don't know what the weather is, but does it ever get cold?
It gets a bit chilly. Well, for us native Jamaicans, we get chilly in winter, like from the months of January to like late February. We will have some cooler weather, but that's
Yeah.
about it.
Not like Delaware. I'm from Pennsylvania, and I'm living in San Diego now, but, I know how harsh the winters can be, and it's like they never end. You think you're out of it, and then March comes, and you're like, "What?"
Yeah, and this year in particular, the last frost was very late.
Yeah.
Yeah, so
I feel like it gets later and later every year. I as well do not miss the cold, and I feel like my body's become accustomed to San Diego weather when it's, like, 50 degrees, it feels like it's freezing cold and I need a winter jacket. So, yeah, I'm sure that adjustment was difficult. In the hospital that you're in, are there other, international travel nurses?
yes, there are. There are quite a few from other Caribbean countries such as Trinidad and Tobago, some Bahamians, and from Barbados as well. Sorry, but they take nurses from the continent of Africa, from Nigeria, from Ghana. So a lot of international persons to the USA do come to the USA to continue their nursing journey.
It's so crazy that I've been a nurse for so long and I haven't experienced this firsthand. Like, I'm disappointed that you're the
Oh,
first
you never
person.
met an international?
I mean, maybe I did and I just didn't know, like,
Oh,
I just assumed they
they
lived here,
were
worked
bo
here, and
yeah.
that's how it was. I didn't, ask the questions for, really how did you end up here, and it could have been a program like that. So, what is we talk about the weather differences, obviously, but what is there, like, medical differences between Jamaica and the United States?
First of all, for me, an initial thing that stood out for me was the units are co-ed. So there are male patients and female patients housed on one unit. In Jamaica, we don't usually see that.
That's crazy for me to think that they're, like, not co
Yeah.
have thought that would have been a thing.
Yeah. So the male patients are on a different unit. I totally understand why. Because sometimes you have patients that do ambulate and you don't want those patients with another gender. So yeah, that was like one of the first things that stood out to me.
Did you know that coming in, or was that something when you got onto the unit that that was like, "Whoa."
When I got here, I noticed that. I was
Yeah.
like, "Okay, this one room was a male and this room's a female, okay."
Yeah, that's such a different concept for me to think about. Did what do your coworkers, I'm sure you shared that with your colleagues. Did they what are their feelings on that? Do they feel strongly that they would like it to not be co-ed?
A few of them, because a few of them kinda have, like, preferences in terms of gender for patients, but they were okay, like, knowing because the rooms are private or semi-private, so there may be 2 females in one room, and then the other room has 2 males, so
Yeah.
I think that was kinda okay for them seeing that?
Yeah. Yeah,
Mhm.
that's why I just again, I loved our conversation because 'cause I'm learning so much and just little things like that, you don't think that would be, like, different. You just assume that that's how it would be everywhere, right?
Yes.
Yeah, yeah, and I know that we had mentioned, like, the different diagnoses, like, that you maybe see here versus not seeing in Jamaica or even, like, the treatments for those is like, what
Yes.
is there something that stands out to you that you've noticed while being here?
Here, well, there's a lot more availability of medicines here. The diagnosis here somewhat tends to be a bit more complex,
Okay.
like multifactorial things happening and being treated, which is the same in Jamaica, but I think the depth here is a little bit more. There's more opportunity for investigations that lead to like further diagnosis and stuff. So, yeah.
Yeah, and is was that hard? Like, were there diagnoses that maybe you didn't know about? I mean, it happens to me every day. There's
Yeah.
I've never heard of. Was that an adjustment, or did they? I'm sure, in my experience, it's facilitated through like, okay, here we can look it up. We can learn about this together. But was that overwhelming at first, or did it just you just kind of go?
It initially it was a bit challenging, I must admit, but I did look up a lot of things when I initially started.
Yeah.
And I think that we're not going to know everything that's out there initially.
Mhm.
So even as a nurse right now, being a nurse for 6 years, I'm not gonna know everything. I'm not gonna know every diagnosis or mechanism of action of every drug. So I do I'll be humble and I will look things up just to make sure, just to be more confident in providing care for that patient to understand what's going on with their disease process. So yeah.
Yeah, and that touches me more than anything because I feel, and I've said this, like, you never stop learning as a nurse.
That's true.
There's there's new things, there's new tests, there's the intricacies of, studies and testing and whatever it may
Mhm.
be, that we're finding new things all the time. And if you are just so cut off to be like, I know it all, I don't need to look things up, I can go and do my job and leave. It's like nurses like you are what are going to continue the pathway of growth. And I hope that, you know, this inspires nurses listening to know that if you don't know something, it's okay to raise your hand and say, I don't know something. And we look it
Yeah.
up. And, and it's never okay to, just do something because it was ordered or, do it because
Yeah.
that's the way we do it. You have to understand as a nurse, like you said, the mechanisms of action for medications. That's a huge thing to say. And a lot of nurses, I'm sure are like, well, yeah, it does this, but I guess I don't know all the ins and outs of it. And I think it's important
Yeah.
to know that and educate yourself because that makes you a better nurse, a more well-rounded nurse. And it makes your
Sure.
patients trust you because you can explain it to them. If you understand it, you can explain it to them so they understand it.
Yeah,
So I love
that's
that you
true.
said that.
Yeah.
Yeah.
And then that was one of the reasons I was interested in becoming a nurse because you're constantly learning. I wanted to be in a profession where I was being challenged to learn every day, to know new things. And I was excited about the fact that you had to obtain CEs, like continuing education hours.
Yeah.
Nurses, I was excited about that. I'm like, okay, well, keep me on my toes and I will be like, keep up to date with what's happening out there. So yeah.
Oh my gosh, it's so funny. I just had to renew my RNC, and
Mhm.
I did 50 hours of continuing education, and it's so overwhelming, but I always try to pick articles that are things that I don't already know, so then I can
Mhm.
learn about it, and I do. I always when I do those, I always pick something up that I didn't know and I can implement into my practice. So they actually, as much as nurses, we hate them, they actually are important because it drives the changes in healthcare.
That's true.
Yeah.
And it
Uh,
kind of keeps everybody on the same page.
yeah.
Mhm.
Well, and that's very true. Like, I came from Pennsylvania, so East Coast medicine, and now I'm on the West Coast, and the differences, oddly enough, are huge, and it is, like, so crazy to me. It's almost like the West Coast is, like, a little bit behind. Like,
Mm.
it's not like we're doing anything wrong or, super ancient, but there are some advancements that I'm like, "I was doing this, like, a while ago, and we're just now doing it here." But, I guess that just shows the progression of the new research being implemented,
Mhm.
trials that happens, and I feel like the East Coast is where tend to happen more so, and I don't know why, but I think you're in a good place is what I'm getting at.
That's good.
Yeah. Something else that was really interesting is the opioid use and
Mhm.
withdrawal I talked about in the initial when I met you for the first time.
Mhm.
Like, do you feel comfortable talking about that and, like, the differences versus here in Jamaica?
Yeah, I'm okay speaking about that. Here in the US, I definitely see where it affects a lot of the population. We don't necessarily see that as much in Jamaica. Well, at the time when I was there, I didn't see a lot. I think after I left, there was like more exposure to like ecstasy and stuff there. Here in the US, I feel like it affects probably a third of the population or a quarter,
Yeah,
based on what I've seen so far. So, for example, if I'm in like a 6-patient assignment, at least one patient would have a problem with opioid use or withdrawal or some substance
yeah,
use and withdrawal. And also the treatment here in the US is a lot it's more available. It's more readily available here. They have better outcomes and better like pathways for
okay.
persons that have been affected by opioid use, for example. Didn't really see a lot of that in Jamaica. Most I saw was alcohol withdrawal, severe alcohol withdrawal with like hallucinations and all of that. But here in the US, and I said that, as I said, there's like better pathways for treatment here. I guess because it's more common here too.
It is. Yeah,
Uh,
I mean, it really it's kinda scary, and that was why, like, that triggered that for me to wanna talk about is it is so, like, it happens so often here, and
yeah.
it's crazy.
Yeah, I was even asking, I'm like, is this stuff really illegal? Because why is it so common? Why? Because there are just so many persons coming with overdose, especially like I've had been in the float pool now, in the ED sometimes, and I see a bit more firsthand when they're more acute in their withdrawal process. So
Yeah,
it's a bit scary seeing all of these things, all of these patients, like the quantity. If, for example, if it came in Jamaica, it'd probably be 1 in 1,000 or so. And I'm speaking about opioids specifically, but here it's more common. It's definitely more common. I just feel like there are a lot of people that are at risk for opioid related injuries and illnesses.
yeah. It affects the populations across the board, it's not just adult patients, it's in our pediatric population
Yeah.
in my world,
Mhm.
pregnant women that are using, and then it affects the babies, that
Yeah.
it is crazy to think about that, there are potentially other countries that don't see this as often as we do, and it's scary and it's sad, and, I think that that brings light to just even more of the differences, and, you know, gosh, that could be a different conversation, but yeah, it's something that when you brought that up, I just felt that that was such a big, bold point to say, like,
Yeah.
that you saw, being here
Yeah,
for.
that was a major difference. Mhm.
And then the other thing before we get into celebrating you and your Daisy Award is the charting system. Were you doing computer charting before?
No.
Yeah.
No, I was not doing. At some private institutions, they have computer charting, and I've like shadowed there, so I saw it and experienced it a bit. But we charted on paper, so we were writing for
Oh gosh, so what are your feelings
processing.
on that?
Pardon me?
What are your feelings on that? How do you feel? Do you miss the paper charting?
Sometimes, because I think it was a bit more concise because we
Yes,
could summarize more.
100%.
So we could like chart by exception or exemption. So just chart like the abnormalities and stuff, especially if it was like a tough assignment. But if it was eventful, for example, if you have like a person that was in DKA getting hourly insulin or hourly treatments, that would be a bit more difficult.
Yeah. I think there's
As
pros
opposed
and
to,
cons to both sides of paper versus electronic. I think there's a lot of pros.
yeah,
It being like you can go to one hospital and then the next hospital still has your medical information, but
that's
I
true.
I I started with paper charting when I was a brand new fresh nurse, and I did not have to chart as much as I chart now. I miss.
Yeah, yeah,
Yeah, yeah,
yeah. There, yeah. Yeah, there's definitely a big difference. As I said, we could summarize a lot more and
yeah,
just like pinpoint events, which is what we had to do because the nurse to patient ratio was a lot. Yeah, but being here, yeah. Maybe I'll spend like 30 to 45 minutes in the US charting, like for like initial assessments.
right.
But in Jamaica, it'd probably be an hour. Just because
Okay,
of the writing and, like, the number
right.
of patients and stuff.
Yeah.
Mhm.
So pros and cons.
Yes, definitely.
Well, let's get into celebrating you, and the whole reason I met you in the first place was you were a Daisy Award recipient, and your name came across the board because you were working with AMN at the time, well, you still are, but what like, I just think it's extremely special that you received this being, on an international travel nurse journey, and you made
Mhm.
such an impact on a patient that they felt that you deserved to be recognized for the extra steps you took for that patient. So, I actually don't know much of the story, so I would love for you to maybe share that experience of, like, the patient who nominated you, because I think that you know who that is.
Yeah, yeah. Afterwards, I figured out who it was and
Yeah,
how I received the nomination because, when you have a good rapport with patients, they're like, "I'm gonna nominate you for a Daisy Award." But sometimes I don't know if they actually follow through on that. So when I received the award, I told my manager at the time that I got an email that I received the Daisy Award. And she was like, "Congratulations, very excited about me." And I said to her, "I'm not sure where it came from or who nominated me and everything." And I think she did some digging and figured it out. So it was a patient that was admitted to our unit. He was what was considered like a frequent flyer, but I hadn't met him before. So he would come to the hospital, I guess because of his medical condition. He was a patient with end-stage renal disease, getting dialysis and stuff. And that is a very challenging journey because I've seen a lot of that in Jamaica previously. And coming to the US, I see that a lot too. So he was in a lot of pain. I stayed on top of his pain medicines, like making sure that he was getting it every 4 hours or 2 hours as ordered. And we had a very good rapport. We were talking about medications as well. I was giving him some medication, telling him, hey, this medication is used for this, that to help absorb some of the phosphate. I was going through all of the stuff with him, and I guess he appreciated all of that and the time I spent with him to make sure he understood everything that was going on with his condition. So I think that was what prompted him to nominate me for a Daisy Award.
Yeah.
And then at the time I was working with AMN, so it went to my unit manager, and my unit manager saw it, and then she added some portion to it about how she observed me working with patients, and then she submitted it to the agency because there are steps, because she was my direct manager, and then I had my manager from the agency.
Oh,
So she submitted it through the steps. And then, yeah, I got my Daisy Award.
I love it, and congratulations. I mean, that is something that I really truly value as an honor. You went out of your way, and a patient in their worst state, right? They're in the hospital.
Yeah,
They don't wanna be there, but they still recognize the ability that you went above and beyond what he's experienced in the past, especially being a frequent flyer patient. That just
yeah,
hits it even harder because he knows how he's been treated. He knows
yeah.
all of
He
these
knows the
experiences.
hospital very well.
Yeah, and the fact that you were able to honestly, like, listening to your story probably change his mindset about that hospital and about that unit because he probably didn't have the most positive experiences, and then you had him one day and showed him dignity, and you showed him that he was a person that mattered, and that's I can assume I'm in my head living, trying to see what that would feel like.
Mhm.
And that's what it sounds like to me that, you educated him, he saw that you cared, and you took the time to help him, and that you honestly deserve that, and I'm so
Thank
happy
you.
for you, and honestly, congratulations because it's it's amazing what you did for that patient.
Thank you. I appreciate it.
Of course, and, something that you talked about was medication and explaining
Mhm.
to him, and this is the second time we've kinda talked about that in this conversation, and, I feel like if I remember correctly, we did talk about this initially when we met,
Mhm.
the medication safety things that you've seen here in the United States compared to Jamaica.
Yeah.
What is something that you see with that?
In Jamaica, administering like opioids and higher level medications would always, I guess because it was like paper charting too,
Yeah,
but it would always require a two nurse check for administration, disposal, even withdrawal of the medication. It would require a two nurse check. And when I was in school and throughout my nursing career, insulin was seen like as a high alert medication, but here it's not really seen as that, not so much. So yeah, that was a major difference for me. When I asked someone about it initially, they were like, "Oh, you scanned it, so that's a second check." Like,
yeah. I know, I don't agree with that either. I mean, in working with babies, we do double check a lot of medications compared to what they do in the adult world, but
yeah,
I when you say insulin, it makes me think about when I was, a brand new nurse and you gave insulin to patients all day. You would literally
mhm,
carry the vial in your pocket and be like, "Oh, 3 units. Okay, boop, boop," and it's like, how? Because it is such a, it is a high alert medication. And I think it's
yeah,
still here in the United States. I mean, insulin drips are obviously treated differently than, just giving like a Humalog or whatever to a patient after they eat, but it still is insulin at the end of the day.
yeah, yeah. Yes, yeah. It is definitely because we were taught that we use pethidine a lot in Jamaica. So we were taught that we should treat like insulin on the same high level of high alert as pethidine.
Yeah, I
So,
don't know what that medicine is.
yeah, it's an opioid, just
Okay.
similar to like morphine. Codeine is in the same class as codeine. I think you're more familiar with like codeine here. Yeah.
Yeah. Oh, it's just the differences amaze me, and, I feel I feel like teamwork too. Like, I can
Mhm.
imagine that in Jamaica, that it maybe was a little bit more of a team effort because we are so individualized here in the United States with the electronic charting. We have a MAR, we have scanning. We can eliminate the extra person to give us that extra check, but, I don't think that we should go away completely.
No, definitely not.
Yeah.
Nursing is a team sport.
Yeah. Yes. Okay, so something I ask, and we didn't do this in the beginning because I just wanted to talk about everything else first, but the question I ask all my guests is like, what is your passion in nursing? Like, what is something that just really holds true to your heart that you carry with you and that you just feel so strongly about?
Feel strongly about patient care, patient education. Definitely. So those are my two things. I feel passionately about primary care, like, before pre-hospital stuff,
Yeah.
that I feel that that's a big area for improvement in healthcare overall. So that is definitely my passion, definitely getting education out there to patients, to how they can care for themselves, care for their health, to avoid hospital visits. Not completely avoid them, but some things can be lessened, like, you know?
Yeah, of course. I think that that starts with going back to your Daisy Award, like frequent flyers, how can we eliminate that frequent flyer? And it's education, and it's
Yes.
understanding, and that's the only way to do it. Unfortunately, some diagnoses, disease processes require you to unfortunately have to come to the hospital more often, but if there are ways for one admission and the education during that admission to eliminate subsequent hospital stays, like that's
Yeah,
amazing.
that's
And
true. Mhm.
so I think that you are doing what you what you want, even though you're in the hospital setting. You providing the education and medication education to your patients is huge, and that's one of the main things that gets rid of the readmissions.
Yeah, and I usually tell my patients I'm here for like X amount of hours. I have time. I usually tell them I have a lot of time. We can go through this.
Yeah,
Yeah.
we do have time. It's 12 hours. Like, we are there. Like, if
Most
you think about
times,
it,
yeah.
we're there 12 hours. So there are busy days, but there is the time to spend with the patients and give them a smile, right?
Yes. Definitely.
Yes. So, what could be to close this up, what are some maybe 3, it doesn't have to be 3, but just a few pieces of advice, from what you've experienced in your nursing career in Jamaica and here. What are 3 pieces of advice you could give to nurses out there?
Nurses need to support nurses. First of all, just giving an extra eye, sometimes being available to like bounce ideas off, like, hey, what do you think about this? Because not every shoe fits, or not like everything fits every patient. Um, like just supporting each other, giving like an extra eye, say, hey, this is going on with my patient. I already did this, this, this. What else do you think I could do before like I page a provider, or, you know, things like that? Or like you could say, I rolled out towel instead of like a cushion or a beaded cushion because that was more comfortable to the patient. Do you think that's okay? Just running things, just being available to hear things from other nurses. So first of all, nurses should support each other in that regard. Just being a listening ear for like clinical stuff.
100%,
Definitely.
100%.
Um, I would say take it slow. Sometimes we get ahead of ourselves and we rush as nurses. There are instances where we do need to rush, but I think for maybe 50% or more, we can go at a moderate pace. Um, just to be calm within ourselves while providing care, and so that the patients can feel comfortable too. So yeah.
Oh, and
uh,
that's very true, like, taking it slow, when you rush, that's when mistakes happen, and
yeah, definitely.
not everything is a rush. That's why we prepare for emergency situations because that's when mistakes happen, are in emergency situations because 'cause we're just, rushing to get certain things done. So I think that that's a really good piece of advice.
Hmm. Yeah, and definitely preparedness as well. Being prepared as a nurse is very essential. For example, if you're not in like the emergency department and they're sending a patient up, being prepared for that patient, it helps with the care that you provide. So even the other night, I had a patient and I read through his chart before he came to the floor. And I was kind of prepared for him. And he was like, "How did you know that?" I didn't read your history. What do you expect? I was expecting you to come here. So I did my research.
Yeah.
So yeah, it's good.
And that
Being
helped
prepared.
you, and that helped the patient. I mean, there's another great patient experience story is that he was like, "Oh my gosh, that builds trust, that builds respect, but, like, you're gonna be in charge of his care for the next X amount of hours," and you come up there and you're like, "I know this, this, and this." He's gonna be like, "Whew, I don't have to worry. I don't have to tell my story again." And
Yeah.
that's huge. Girl, you're a great nurse. I can
Thank
just
you.
tell by the by this conversation especially just, sealed the envelope on that. Like, you definitely have a passion and the heart to be a nurse, and I'm so glad you took that risk to get into this travel nurse or international travel nurse journey, and you're, bringing your excellent care to that wonderful hospital in Delaware. So thank you.
Yeah, I appreciate it.
Of course. I really appreciate you coming on here and, talk again, we were just supposed to talk about the Daisy Award, but I felt that you had a lot more to bring to the table. So thank you for being so open and honest about all of your experience. Is there anything else you want to share?
Being an international nurse, it is risky. It's scary because you leave everything that you know, everything that you're familiar with, to come to a new country. And there's definitely going to be a culture shock. Even simple things like the layouts of the units.
Yeah.
Because as I said, like in Jamaica, we had curtains mostly separating each patient.
Yeah.
And most patients here are in rooms separated by walls and stuff.
Privacy.
Yeah, yeah. So they do have a little more privacy in that regard. Yeah, so it's good.
And it's worth it.
Yes,
You
it's
said you
definitely
wanted to
worth
tell your
it. It's definitely worth it for me in my experience.
I love it. I love it. I'm so glad I was able to learn more, and I know that everyone listening to this episode, even if they're just listening and not seeing, they can see and know the person that you are and the nurse that you are. So again, thank you so much for coming on, and I hope we can do this again.
It was my pleasure being here. I appreciate you having me.
Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.